So for our last speaker, we have with us Dr. Pascal Vidal. He's a medical doctor, also graduated in homeopathy, Chinese acupuncture, global posture reprogramming. He practices and teaches auriculotherapy, auriculomedicine. Dr. Pascal Vidal is also a specialist in photonic medicine. He's the former president and co-founder of the International College of Auriculomedicine and Auriculotherapy Review, and president and co-founder of the Institute of Photonic in France. Today, we invited Dr. Pascal Vidal to talk to us a little bit about techniques for self-healing in a traumatic situation, like it's the case of what we've been living in the past 2 years. So thank you so much for being here, Dr. Pascal Vidal. Thank you so much. I will leave you to it.
So thank you so much, Maria, and so thank you so much, Abby, to invite me to be there. And actually, there are many ways to help people suffering from PTSD. I think the basis of the help we can provide to somebody who is suffering, especially from a PTSD, is really to have to be able to give him love in terms of attention and, of course, of non-judgmental listening to what he says and to what he expresses. And especially we have been during these last 2 years seeing many people in dramatic situations, in traumatic situations, both from their personal suffering as patients of COVID and going to UCIs and extreme distress, but also because the pandemic and the vaccination and the choice of vaccination or non-be vaccinated has made a lot of separations, of cleavages inside the families and among friends. And so there have been so many traumatic situations. And of course, the media, who are always spreading the news of the pandemic increasing and all that. I mean, it's a climate around who is really stressing. And of course, so I say there are many techniques that can be used. And of course, there is the chromo-auriculotherapy that Dr. Daniel Aziz uses, which is really effective tool using light, especially yellow light on the limbic areas of the ear, and who gives really amazing results. Of course, there is also this rapid eye movement therapy from Francine Shapiro. And but there are many other ways to help, especially, for example, traditional medicines like Chinese acupuncture, like Ayurvedic medicine can also be of good help. And of course, there are also some therapies which are not recognized as scientifically based for the moment, but that can provide a lot of help and comfort. And I'm thinking about, for example, some specific techniques on food reflexology, because there are these techniques try to help to make a connection between body, mind, and soul, and help the people to step away or to step back from the problem they're living. And then that provides them a space in which they can feel much better. And but I choose today not to speak of all of these, but to speak of more of auriculotherapy that has been elaborated by Dr. Paul Nogier, and then who has been carried on by his son, Raphaël Nogier. And I will show you then afterwards a small movie in which I will present 3 small protocols of self-massage of ear points that can help in specific situations, because I think it's also good to be able to be independent and to try to help oneself as much as possible. And so before seeing this movie, I just want to give some rules for this kind of treatments, self-treatment. If you are, I mean, you will see that on the movie, one of the first slides is a map of it's a ear map of the ear reflex zones of Dr. Paul Nogier. So then you will see that there are many representations of the brain, for example, takes a lot of space on the lobule of the ear, but all the organs are also represented in the ear. And practically speaking, when we are going to perform to somebody who want to help, or if the person can do it also itself alone, it's also possible. But there are some conditions that have to be respected. The first one is that if you are a right-handed person, you will begin to treat your right ear. And it's the contrary, if you are left-handed, you will begin by the left ear. And both the ears have to be treated. The best for the when you are treating somebody, I mean, it's the best is to be lying down, because then there is no risk of a vagal discompensation. So, and it's a kind of massage that you are going to give a pressure, acupressure. So you will see on the movie that there are two different ways of giving this acupressure, two different tools. And it's about how to say 30 seconds by points, and the patient has to breathe normally. This pressure has nothing to do with the breathing. And of course, if the patient has a hearing, we have to remove it before. And of course, as I said, we practice on both the ears. So I suggest we can display the movie. And if I need to stop, I will ask you to stop. And otherwise, we can go on. So I will show you 3 different protocols. So here you can see, if you can stop a bit on this image, you will see that on the left side, for example, you have on the yellow part on the bottom is really all the brain areas and the limbic areas. You will see that in the concha you have all the lungs and you have all the abdominal organs, and what is green is more in relationship with the limbs, lower limb and upper limbs. We can go on. So I show that we can work in 2 different ways. There is a kind of stick of glass, or it could be of plastic also, but it's usually made of glass, which is nice because it has a round extremity, which is soft, and it's called a peristick, and is available in retailers of acupuncture. Otherwise, you can use a single pencil, which is round also. And the basic thing is that in both the cases, the best thing is to, before doing this acupressure, the best is to sterilize the skin of the ear and the extremity of the pencil with a little bit of alcohol. So we begin here with a protocol of relaxation on a young man. And in this protocol, we are going to use 2 points, which are quite interesting. First of all, we put alcohol, and we are going to look on this line, which is just around the tragus, and we are going to look and pressing to find the point which is the more sensitive. And in the more sensitive points, we are going to press for 30 seconds. That's, of course, I'm not remaining here for 30 seconds, not to make it too long, but it's only to show. Then inside the ear, at the root of the helix, there is a small depression you can find with the nail, which is called the 0 point in auriculotherapy. And also there you press for 30 seconds. And then when you have done this thing, you are going to do exactly the same on the other ear. So there is first of all this point which is around the tragus, and you find the more sensitive point and you press for 30 seconds, and that's really a relaxing point, quite interesting. And then we are going to use the other point. So I look with my nail, there is a small depression at the middle of the root of the helix, and then you press 30 seconds with either the pencil or the peristick, and that's really an important point because it triggers and it will relax all the organs, all the abdominal organs, all the heart and the lung, and that's quite interesting, especially in situations of stress where you have somatizations. So now there is another treatment with 4 points. with for global balance and psychic balance. So we have the same first point as in the other protocol. And we are looking here at the middle of the lobule in the point where usually we put the hearing. And to help to make a correct acupressure, we can put the finger, if it, because it's difficult to press properly. So then we put the finger below and we press on the middle of this lobule on the hearing point, which is called the master sensorial point, who has in auriculotherapy also a big relaxing impact. And then on the small fossa, scaphoid fossa, which is on the top of the ear, I mean, there is it's a kind of triangle if we divide it with a line. So we look pressing on this line, and we try to find the more sensitive point which corresponds on the first third of this line to the point called Shenmen. And this Shenmen point is a point quite interesting because in all anxiety, in sleep disorders, and also in anguish, it's quite an effective point. And so for the same reason, we press it for 30 seconds. And then after that, we come back to the 0 point, which is the point which is at the small depression at the middle of the root of the helix. And then we press for 30 seconds because it relaxes all the body and because it has a parasympathetic stimulation impact. And then we reproduce exactly the same on the other side. So we begin with the point 0' point, which is the point around the tragus, the more sensitive point, for 30 seconds. Then we are going to look for this Shenmen point, also, which is in this fossa, the point the more sensitive in the line which divides the triangle of this fossa. We press it for 30 seconds. And these are really powerful points. And then we have this master sensorial point, which is the point corresponding to the point where we put the hearings on the ears, and also has a very important balancing impact, and completing with the 0 point, which is a point which it makes the balance between the sympathetic and the parasympathetic, that's to say the autonomous nervous system. And then there is another third protocol for anxiety and sleep disorders, which has more points than the previous one and has the same points of the last one. So we are going to see it again. So all the 0 point around the tragus, that's the first, for 30 seconds, even if it's not 30 seconds on this movie. Then we have the master sensorial point, which is the point of the hearing, which is also a deep relaxing point. And then we have here at this bottom part of the cartilagus there, we have a point which is called the aggressivity point, and which is a point, for example, that all the people who have compensation processes like drugs, like alcohol, like tobacco, etc. It's always good to stimulate because it's a kind of aggressivity that you cannot get rid of and that you direct against yourself. So that will help you to really get rid of this aggressivity and stay more calm and peaceful, and especially more kind towards yourself. And then we have there below the antitragus, we have the hypothalamic point. The hypothalamus is really an important part of the limbic system, which processes all the informations coming from the body, and also all the nervous and system informations coming from the brain. So it's a kind of a central office where all the informations meet. And so it's really an important point, especially on really stressful situations. And then we have also then the 0 point, which is the autonomous nervous system control point. And then we begin again with the same points on the other side. And then, so you can see all these points, relaxation on the left and the upper side, the balance, psychic and general balance, and anguish and sleep disorders. And I have to say that to be really effective, this treatment can be done twice daily. And I would just like to thank Dr. Rouxeville, who has been able to set up these protocols. And practically speaking, I just want to end saying that when you practice this, you can really feel a difference, especially, for example, when you are having sleep disorders on the middle of the night, you can stimulate the few points, and then you will see that in 15 minutes, you are back to sleep. So it's quite interesting, especially on these times of tension and anguish and anxiety. That's what I wanted to say for today. Thank you very much for your invitation.
Thank you so much, Dr. Pascal. It's really interesting to see that we can help ourselves in these steps, and there are actual positive ways that we can take to make ourselves feel a little better. It's like I was mentioning in the beginning, shedding a little bit of light in these positive ways. I believe that's what we need right now. As you mentioned, there's already enough negativity entering in our lives through many vehicles of information and everything, and having this positive way of dealing with something is really, really interesting. Thank you so much for sharing.